Hi, everyone. I'm WellSky Marketing Manager Shannon Pike. Thank you for joining today's webinar, Getting Started with Synzi, Guidance for Optimizing Virtual Home Health and Hospice Care. Synzi is WellSky's preferred virtual care technology provider, and WellSky clients can now request an exclusive free trial of the solution. If you haven't yet requested your free trial of Synzi, you'll have an opportunity to do so at the end of the webinar. Before we get started, I have a few tips to share that will help you get the most out of today's session. On your screen, you should see the most important components of the presentation, the slides, a Q&A chat window, and a list of additional resources. These windows are resizable and movable. The resources window provides helpful links to educational content from WellSky. The Q&A chat window can be used to ask for help if you're experiencing any technical issues and to submit questions. In the coming days, we'll provide a written FAQ document in WellSky Online Help to address the most frequently asked questions from today's webinar. This slide has an important note. The content of this webinar is for informational purposes only. WellSky is not providing medical, legal, financial, accounting, or other professional advice. For that, you should seek the professional services of an experienced, competent practitioner in the relevant field. And as we all know, guidance around COVID-19 is changing very rapidly. It is very important for you to track developments on the official web pages like cms.gov and cdc.gov. And we provided those links to pages at the bottom of this slide. Here's what you can expect from today's session. First, you'll hear a brief introduction to the Synzi virtual care software platform. Next, 3 successful home health and hospice agency leaders will share their experience with using Synzi to deliver virtual care. And finally, you'll get a sneak peek of the forthcoming integration between WellSky and Synzi. So here to introduce you to Synzi is the company's Chief Experience Officer, Mark Knudsen. Mark is responsible for the overall client experience with Synzi's platform and solutions. He works with clients and across the Synzi team to ensure their requirements drive solution strategy and to make sure Synzi delivers an intuitive and valuable user experience. Welcome, Mark, and with that, I'll hand things over to you.
Thank you very much. Appreciate that, Shannon. First of all, on behalf of Synzi, we're super excited about the partnership with WellSky. I think there's a lot of great opportunity to help deliver solutions that are effective for our mutual clients and even more importantly for the patients out there who need care. So just to give a brief overview of Synzi for those of you who may not be familiar, we are a technology-based company based in Florida, and we really are offering a solution that securely integrates multiple channels of communication with the goal of facilitating remote care delivery or virtual care. And we run on everyday consumer devices, so you may have a web browser on a laptop or personal computer. Maybe you're using an iOS iPhone or an iPad or an Android smartphone or tablet. Basically, you can use Synzi and access Synzi from any of those types of devices with really any type of internet connection. Home Wi-Fi, commercial Wi-Fi, or even cellular data is fine. And the idea is to allow an effective conversation to take place, whether that's real time or it's a back and forth exchange between providers, patients, and their caregivers or family members. And we really want to be a tool to help facilitate effective care over distance, improving patient satisfaction, and most importantly, improving patient health outcomes. So in terms of, what can you do with Synzi? You can have a video call, should look just like what people are used to in their personal lives or professional lives, using Zoom or FaceTime, except that this is secure, it's encrypted, all of the information is confidential with no risk of exposure. So you can get into the detailed conversations that are needed to deliver that care. You can also secure message back and forth. Looks just like chatting or texting, but that can go back and forth between a provider and another colleague, maybe a specialist or another physician. Those same messages can go back and forth with the patients and their family members. And you can really bring that whole group or that whole care team into a conversation as appropriate. So in addition to those kind of back and forth mechanisms, Synzi also supports programs and assessments that lets you schedule education, condition-specific reminders, anything that might be appropriate to reinforce with the patients and their family members the care plan that's needed. So that can be delivered through text, email, securely within the platform. The assessments allow self-reporting from the patients so that you can get a regular pulse check on how that patient is doing. We even support flagging responses to generate intervention alerts to make sure that care is delivered in a timely manner. And all of that is delivered in a way that you can report on it. So you can access those communications, you can see what the interactions are, and really have a good sense of what is that dialogue, what is that remote care experience for the patient as well as for the providers. So with that, I appreciate that chance to tell you a little bit about Synzi and the solution. What's really going to be more exciting is how it gets applied. And so we're going to hear some great insight from folks at Concierge and Aspire that will really show you how to use Synzi and tell you how to use Synzi as a tool in your everyday practice and care delivery. So thank you.
Thank you, Mark. And as Mark said, now I'm pleased to introduce three of your peers who have successfully implemented virtual care at their agencies using the Synzi platform. First, Linda Murphy is the COO of Concierge Home Care. Concierge has offices throughout Florida and is one of the largest providers in all the areas they service. Their reputation as innovators and delivery of quality outcomes has allowed them partnerships with all their local hospitals as preferred providers. Linda has been involved with multiple bundling projects and ACOs and initiated several pilot programs that have yielded reduced rehospitalization rates while optimizing symptom management. Welcome, Linda.
Thank you. It's such a pleasure to be here.
We are happy to have you. Next, we have Haley Brown, Director of Complex Care for Concierge Home Care. Haley has worked in home health for 10 years with experience in billing and intake and as a field clinician and clinical manager. In her current role, Haley is a member of Concierge's Innovation and Solution team. She's particularly invested and proud of the innovative strides they have made from a virtual care and specialty program perspective, as that's where most of her time is spent. Her passion is using an innovative approach to improving patient outcomes, allowing seniors to safely age in place. Welcome, Haley.
Thank you for having me.
Course. And finally, we have Chris Carter, CEO of Aspire Home Health and Hospice in Utah. Chris is a cutting-edge thinker. She is continually studying the marketplace trends in other industries to find ways to improve the delivery of home health and hospice care. She's an early adopter of telehealth and is constantly seeking ways to improve patient care at her agency. Some of the innovative telehealth programs she's implemented are virtual therapy visits, COVID-19 infection control and education, diabetic care, and a CHF program. Chris's long-range goal is to use technology to work smarter instead of harder. Welcome, Chris.
Hey, how are you? Thank you for having me here.
I'm doing great. Thank you all for being here. We're so excited to have you. So we're going to spend quite a bit of time today discussing the Synzi platform and best practices for delivering virtual care. But Linda, Chris, and Haley really emphasized to me that your agency's culture can be a key determining factor in how successful you are at implementing a virtual care platform and really at implementing anything new. So I'd like to start by asking Linda and Chris, why do you think your agency culture has such a huge impact on your overall success? Let's start with Linda.
Absolutely. Culture. When I started Concierge Home Care back in 2015, culture was always at the forefront of everything that we did. So our mission is really truly to take care of people who take care of people. And we try to live by that day by day with a servant leadership mind. Our values, tie into our mission statement, and innovation is one of those values that we have. So we use innovation to overcome challenges and meet the gaps in care. throughout the continuum of care when you think about it from a healthcare perspective, and especially from a post-acute setting. We've always been early adapters to technology. My team probably gets frustrated with me at times when they're like, oh, a new idea. But it's really helped us be on the forefront to understanding what's coming. You know, honestly, about 2 years ago, actually it was in June of 2018, I was looking at, especially CHF and with a lot of our pilot projects with some of the hospitals, on how can we move that needle, because we were not seeing the needle moving much further than where we were at from the rehospitalization lever perspective. So we had done a couple of pilots where we were doing some virtual care and telemonitoring with patients, and we knew when we first started one of our pilots in one of our offices, our rehospitalization rate was kind of day 7, day 8. We were seeing most of the patients going back to the hospital when we did our root cause analysis. So we implemented virtual care and virtual visits every single day of those first 7 days. Then we started to see our rehospitalization rate shifting when we started to study those analytics to day 13 or day 14. So again, we were able to shift those virtual visits in those first 2 weeks, where we were seeing and speaking to that patient and seeing them face to face on a daily basis. And all and behold, we were having some successes. So I knew that there was something key to the ability to have those additional touch points and get better outcomes. But I was looking at how I could afford to do that in the small margins that we have in the home care world. So really understanding how we tie effective care, how we tie in integrity and caring and the quality and the innovation that's part of our culture and our mission, really set us up for success, especially with implementing a virtual care platform to everything else that we do in the way that we deliver care.
Thank you for sharing all of that. Chris, what about you? Why does your company culture have such a big impact on your success?
Well, I believe that culture eats strategy for breakfast, and I think it's great to have all these wonderful ideas, but if you don't have a culture that supports it, people will fall back into their old habits. You know, Aspire has a culture of just being kind, but part of being kind is being very clear and about expectations and holding people accountable. Being unclear is unkind, and so setting those expectations inside the culture of being clear and helping people understand what it is exactly that they need to do helps set them up for success. Another part of our culture here is a culture of continuous improvement. I always want to deliver the best care possible and have the best patient care and the best patient experience and outcomes. And so I'm constantly looking for ways to improve our delivery of care. About 4 years ago, I started looking at other industries to see what the trends are so that I could maybe implement those ideas in home care and hospice. And I really saw the virtual piece coming out as a really strong point. And I saw it as a way that you could have additional touch points along the way to help prevent hospitalization. And so 4 years ago, we wrote a program which we called Prevent the Event, and it could really see the value of those virtual touch points with patients to help stop them from going to the hospital. And it added a different level of the delivery of home care and hospice in that the people, our patients became people. They've always been people, but you know, in our office, a lot of times our office staff and the schedulers didn't have the points of contact, or I didn't see the patients. And so to be able to see them virtually allowed it and made their care a lot more personal in the services that they were delivering. And so I saw the value in all of that and was looking for ways to continue to promote those really great outcomes and patient engagement. Unfortunately, 4 years ago, our platform of technology was not dependable. And so even though we built this really, really great program and had the staff behind us, the technology didn't support it.
I think that's a really great segue into the next question I had for y'all. I was going to ask you some more questions about culture and the impact on that with moving forward with implementing virtual care, but I think you did share a lot of that, and I think if there's more, we can definitely get into that later on. But what Chris just mentioned about technology, as everyone listening today probably knows, you know, implementing anything new can be difficult for your staff and your team. So it's important that agency leaders are setting their teams up with the right tools for success. So Linda and Chris, why did you ultimately choose Synzi as the virtual care technology platform for your agency? And let's start with Linda again.
Sure. As I mentioned, it was June of 2018 when we actually sat down with Synzi, and I wanted a full communication platform. I really wanted the ability, very similar to what Chris says, is from the time when my clinical manager does a welcome call and actually connects with that patient all the way through the virtual care nurse that's going to be taking care for them. But how do I stay in connection with all these patients that we touch on a daily basis? We currently do, you know, about 11 to 12,000 new patient admissions on a yearly basis, and that's a lot of clients that you're touching. And frequently you would find, or I'd get a call from a patient that they honestly don't remember the name of the company, but they remember their nurse and they remember the therapist. And when they go into the hospital and they say, well, I want, you know, Nurse Susie back. But sometimes connecting the agency with Nurse Susie is a little bit more difficult. So I wanted an ability that I could touch those patients on a continuous basis. So now we're able to send out messages on a regular basis and communicate with patients that have been on service with us any time in the past. So one is being able to brand ourselves and connect with those patients from a long-term basis. I also wanted the ability to customize and integrate cadences that went along with our educational protocols. We put a lot of time and effort into disease-specific protocols that are inside of WellSky with our progress to goals, but I also wanted to find a way of how I could connect all of those dots and connect that with additional educational pieces that we actually can push video education to our patients. We can set up cadences that go along with whether the patient has CHF or COPD or diabetes. And it really, those protocols go along and the communication is aligned towards the goals that we wanted to accomplish with that patient. I had no idea, honestly, as I was implementing, that I would discover the benefits from a cost effectiveness on-call practicalities. I remember the first time we had a patient that lives out in Keystone. So if anyone knows about North Central Florida, it's about an hour drive out there in the boonies where nobody can go. But we had a patient on IV antibiotics that was having some trouble with the SASH system and the delivery of those IV antibiotics. And instantly my nurse could get on the phone, walk them through, because now they visually can see and saw, oh, they just got the connector on wrong, and walk the patient through that, which normally would have cost me having a nurse pick up the phone, drive another hour to get out there if they weren't already seeing a patient at that moment, and then another hour back. We were able to correct the problem within 10 minutes, and patient was satisfied, nurse was satisfied, and everybody was like, oh, okay, this works. But it really was just, I felt that they had all the pieces put together that would increase that patient engagement from start to finish. And I also, they have the ability to bring in interpreters as well into those conversations. So any of our patients, it answered our problems if I didn't have a Spanish-speaking nurse or I didn't have a therapist that spoke this language, that we could connect with those patients and bring those folks in immediately.
That's great. Thank you. Chris, how about you? What made you choose Synzi for Aspire?
All the things that Linda said, she's so wonderful in describing everything and the patient value, the value that Synzi brings to patients. One of the things that I particularly loved was the different levels of being able to communicate fast and efficient with your patients. You have text messages, assessments, you have email capabilities, you have staff-to-staff communication, you have visual, the opportunity to remote in and see the patient visually. So there's so many different ways that you can make Synzi functional. The previous platform that I used, there was only one way to communicate, and that was through the virtual. You could only see the patient. You couldn't communicate through staff-to-staff phone calls or communication through text messages. There was only one mode of being able to use this device. And so being able to have all these really cool functions at your fingertips without having to switch devices. That was one of the big issues is that with our previous programming, we had asked our nurses to carry an additional tablet. And nurses have enough to already bring in and out of a home, or, if they were at another patient's home and another patient wanted to video chat them, it was really hard to, whip out the tablet in the car and still have all your other devices and your phones. And so one of the reasons why we chose Synzi, it was a bring your own device. And so the nurses didn't have to worry about an extra piece of equipment that they're using. They could just use their cell phones. And so the ease of being able to use the device on the fly, as many of our nurses are constantly moving from patient to patient, and in the ease of it. And what was really nice is that all staff had access to the app. It wasn't like they had to have access to the tablet in order to connect with a patient. And so that also helps that all of our staff members have access to the Synzi program and can use it to communicate with each other and with patients. And so for me, it was really about the functionality and that we did not have to have a bunch of extra devices.
That's great. I imagine that all of these benefits maybe, lessened the fear or the concern for your teams being resistant to change, knowing that the solution was going to be easy to use and easily accessible. So that's great. And I think that's going to feed into what we're going to move to next, which is some insights from Haley. So next we're going to dive into some important considerations for educating and training your staff on virtual care, and specifically in using Synzi. So Haley Brown has played an integral role at Concierge Home Care in standing up the daily operations involving Synzi and virtual care. So Haley, it would be great if you could share some background and your insight on your project management approach for educating and training your team. So I will let you take it from here.
Thank you, and thank you again for having me. So when we look at education and training and project management, one of the things that I really want everyone to just understand through this entire presentation, your entire Synzi integration into your day-to-days, is just be patient and be consistent. So when you start any type of rollout, particularly Synzi, first you need to start planning both how you're going to integrate this into your patient's plan of care, as well as how you're going to integrate this into your team's day-to-day processes. You want to make sure that while you're planning, also prepare for change. You're going to have to meet your team members where they are. Not all of your team members are going to be as accepting and willing to integrate technology into their patient care, particularly when you have clinicians who may be 20-year home care clinicians or 20-year hospice clinicians. This is not normal for them, and it may take a little bit of patience and understanding, particularly If you're an agency where you have a history of failed rollouts or integrations in the past that have been difficult, that may leave a bad taste in some of those team members now. So again, just make sure you're meeting your clinicians where they are. You want to make sure that your training is ongoing. Again, we talk about consistency, but also reinforcing. Let your clinicians know where you're at. Let them know clear expectations and give them all the tools they need to be successful. Your onboarding may look a little different for your clinicians. Your timelines may be a little different for those who are both more willing to accept this new innovation and for those who are not so willing. As long as everyone has the clear expectations and guidelines, the timeline may look different, but just stay consistent with what the expectations are for your end game. As you're training, make sure that you are prepared for your clinicians who may be a little uneasy. Recognize that your clinicians may be a little bit uneasy technology-wise. Again, we talk about those failed outcomes. With that being said, it may be that your clinicians are deflecting that onto your patients. One of the things that we've found with integrating technology into our care plans is that some of our more seasoned clinicians or our more seasoned team members, they come back and they say, well, patients can't because. Patients can't because. And often that's not because the patient can. It's because the clinician is insecure and they're not confident in their ability to explain the benefits to the patient. So if I had to give you 5 tips to train your staff effectively outside of being patient and consistent and just really expanding on those, you want to refer to Synzi as an engagement or a communication platform tool. This is not an innovative tool. This is not virtual. Those words tend to scare clinicians. And are all of those things right? Yes. Are all of these cost-saving measures? Absolutely. But realistically, for your clinicians, to get them on board and even your patients, help them explain that these are really ways that we are going to benefit and we are really going to elevate our patient care experience. Make sure that you're selling this as a way to give increased touch points in a world of healthcare where we're being forced to do less and less in-person visits, but we're seeing patients who are more and more acutely ill following hospitalizations. Your clinicians and your leadership, particularly if you have a model where you have clinical managers and directors and offices, you want for your clinicians to understand that when they come to your leadership team with objections, you want your leadership team to confidently be able to overcome those objections. We can't do virtual care because the patient is a fault risk. Your leadership team should be able to rebuttal that and come back and say, you know what, that's great and we hear you, but let's talk about the reasons we can. And that sounds a little cliche, but realistically, you're going to have to change the mindset of your patients and even your clinicians, but even your patients who are reoccurring home care patients. They're used to getting extra care and they may be confused at why we're starting to implement something new. Make sure that we're changing that can-do mindset. Some people will recommend you finding an office and really championing that one office or that one clinician set. However you choose to do that, if you want to roll it out company-wide, just one discipline, or if you want to do only one branch at a time, that's absolutely okay. As long as you follow the process of making sure to plan, prepare, organize, and be prepared for objections, either way is fine. Just make sure that you understand that the office or the discipline you choose should be a safe set, and make sure they are clinicians who are willing to implement this care into their day-to-day processes. You don't want to start championing with these patients who are, these clinicians who are resistant, or an office who has other struggles going on. Make sure that you choose those very carefully. Linda, did you want to add anything to recognizing, our wins, choosing offices, or any of the pieces that we've added?
Well, I'd like to say, we started small and definitely moved up largely, and we're currently doing anywhere from 12 to 1,400 virtual visits on a monthly basis now, and about 20% of those are actually therapy virtual visits. when we first started, I was so excited, like I usually am, about, the opportunity for better engagement and better outcomes, that I thought every nurse on our team was going to go, oh, this is awesome. And I had ideas that, you can spend 2 mornings a week, or you can spend an hour in the morning now. And we give we have a unit-based pay that we do, that they could do some of their visits virtually with their patients, and there would be no question. Everybody would go, wow, this is awesome. Let me start. Let me do it. We did have some champions in the very beginning, but we had to really rethink and revamp, and we met on a weekly basis, Haley and myself and our innovation team, on how to implement this the right way. And then we actually, probably a few months into it, we decided to go with an actual virtual care team. And that team has been expanding, and those folks are really experts at digging deep into those visits. So we have a whole nursing note that goes along with the visits. There's expectations to the outcomes and the goals, and those goals are tied to our goals on our plan of cares that the physicians are signing off on. We also Haley does a great job leading our Monday morning meetings, and we invite our sales leaders, as well as all of our directors and that virtual care team, where they give out highlights. They review their successes from the weeks. They talk about any patients that we've actually prevented rehospitalizations, so everybody starts to understand how effective this innovation truly can be. It's very, very important to align that rollout also for your sales team, so that everyone is discussing and part of how do we implement, how do we put folks together, how do we utilize this amazing innovation tool to, one, get better outcomes, but also tie to getting better sales and getting additional referrals, because we've tied this all together.
Thank you, Haley and Linda. I think you've alluded to a lot of this in your responses just now, but next I do want to move toward a little bit of a different topic, some of the day-to-day best practices. So you may have covered some of those just now, but hopefully we can dive in here. Haley, can you share some of the specific strategies you focus on at Concierge to get the most out of Synzi and out of virtual care?
Sure. So when you talk about strategies, again, I want to go back to make sure that your strategies fit your team's model. Your strategy should be your goals, and they should really support where you're trying to go with your virtual care program. When you look at that, so Linda already mentioned our 1045 calls. So every Monday, I feel like one of our biggest success strategies is letting everyone know, hey, we're keeping patients out of the hospital. We're able to touch patients more frequently, which allows us a better baseline assessment on these patients. We're able to see that patient's altered mental status is a little different, and maybe they're a little more advanced than where we saw them maybe Monday of the following week or the previous week. So we're able to say, you know what, let's get a UACNS. Let's see if they have anything brewing there. We're also able to pick apart those patients, and to be very honest and to be very frank, one of the objections we hear is that it's just not personal. Virtual care it's so impersonal. It's just a person on the other end. That's actually not true. We have found that our team is able to really build a better rapport with those patients, which again strategically helps us build better patient satisfaction. It helps us identify when patients are declining faster. So those two in itself is just, we could do a whole slide presentation on, the amount of care we're able to provide virtually, and it would truly astonish anyone who hasn't actually provided virtual care to patients.
Thank you so much for that. Next, we have some message content samples. I think, Haley, would you like to touch on just some of the kind of actionable ways you're using the communication tools within Synzi and some use cases for that?
Sure. So one of probably my favorite part, and if anybody has ever heard me talk about Synzi, I'm very passionate about not just virtual care, but specifically the Synzi platform, one of the things that has been just instrumental in getting Synzi implemented into our day-to-day operations is the flexibility of it, particularly the message content. It does not matter whether you're hospice, whether you're home care, whether you're private duty, the ability to customize your message content is key in success. So we have built welcome messages for patients when they first download Synzi. We can set appointment reminders. We've been sending medication reminders, COVID-19 education, all of those lovely things. We can also send extreme weather alerts. So when the hurricanes, well, I call it a pseudo hurricane, when it was supposed to hit Florida last season, we were sending out massive messages, even daily for the first several days when we weren't sure what that hurricane was going to do, reminding patients to get their medications. Do you have your oxygen? Do you have plenty of supplies? Please call us if you need anything. Being able to really customize that to your agency is key. And Chris, do you want to jump in about the amazing story you had with the earthquakes?
Oh, yeah. Thank you, Haley. I appreciate that. Yeah. In addition to dealing with COVID, Utah was hit with an earthquake early in March. And we were able to implement our emergency preparedness plan and had our nurses checking on a patient. Well, one of our nurses found we had a patient with a PICC line that she needed to attend to. But because of the unsafe conditions of the aftershocks going on, and to be honest, her children were frightened, she was able to get underneath her kitchen table and keep her kids calm, and was able to walk a patient's family through delivering that PICC line medication, and was so thrilled that she didn't have to go out in those unsafe conditions. So it is so beneficial to have these messages and these virtual, messages and virtual connections that you can actually build a personal connection and still be able to take care of your patients in circumstances you didn't ever foresee.
Thanks for sharing that, Chris. Before we move on to the next slide, Haley, Linda, Chris, are there any other examples of patients having a positive impact from virtual care that you'd like to share that you haven't shared already?
Well, one of them that I was thinking about that I don't think most folks consider, we're very, very active with several of the CCRJs and the bundle projects here in North Central Florida. But we actually did our first total knee replacement with 3 virtual visits and 3 in-person visits. Now, this was a healthier patient with less comorbidities than the average patient we normally have, but we're even starting to see some huge benefits in utilizing the virtual care from a therapy perspective as well, which I have got a speech therapist that absolutely loves virtual care, and it's got to be for the right patient for the right time, but there's a lot of pieces that you can do to make sure that your patient actually continues those home exercise programs, checks in on those patients, walks them through the pieces. From a speech therapy and swallowing perspective, there are exercises that they're doing, but again, it's just giving you that additional touch point, especially under PDGM, in mitigating some of the risk and the costs that we have, that's allowing us to continue to get the great outcomes that we've always gotten, but actually get even better outcomes with more touch points. And believe it or not, these patients are more satisfied than our patients that might typically have been just getting all the in-person visits.
And 2 things I want to add. So first, Linda, you hit on a really important part that, again, we could kind of go into it, but also understand that virtual care is not going to be for every patient, and that's okay. And then the second thing is expanding that scope of practice. Linda just had a great, therapy piece as well. This is not just for nursing. Our therapists are really able to expand their entire scope of practice and all the education they're providing. In the last 3 weeks, our virtual therapy team has been able to identify 2 UTIs one patient who was not properly monitoring their blood pressure in the home. They had medication complications, and also a patient who had been having blood glucose issues but had not reported that to their provider. All of these were PT-only cases, and the therapists were able to identify quote-unquote normal nursing needs, and they were able to build that into their plan of care and educate without having to call and bring in nursing. They were able to really expand their care in their entire scope of practice.
Great stories. Thank you so much for sharing that. And go ahead.
This is Chris, and I'd like to bring the hospice perspective into this. We've been talking a lot about home health, but as a hospice provider, we've also found many ways to use Synzi, and especially during COVID. A lot of our patients are in assisted livings, and the assisted livings are limiting what healthcare providers can come in, and some of them are actually saying no healthcare providers. So we've been able to use Synzi to be able to complete nursing visits and nursing assessments. We've had our physicians using Synzi to complete face-to-face visits with patients. One of our nurses was able to video her hospice patient singing a song to his daughter and was able to share that with his daughter. But Synzi has actually been a great tool for all of our staff on hospice to be able to connect to patients and in a way that we would not be able to under these emergency conditions. Another thing has been that our nurses have found ways to connect family. Family members are not allowed to come into these assisted livings and the skilled nursings. And so by using the virtual technology that Synzi has, we're able to connect families as well into the communication with the nurse and the patient. And then we've been able to have family members see their loved one and have that relationship at a time that they can't even go see their loved one. We've been able to connect family members and have just real personal moments with them that has really improved patient satisfaction, employees, and their families' satisfaction, and it's just brought joy to people's life.
That's amazing. I love that story about the song that the daughter sang. That's a really beautiful story. Thank you all for sharing all of these good real-world examples of how virtual care is impacting your patients and your staff. One thing you alluded to, Haley, was kind of engaging patients based on their risk. Is there anything else you'd like to talk about here on this slide about that?
Sure. So one of the things, a lot of us also have a telemonitoring platform in addition to Synzi, but it's important to remember that Synzi is so much more than just virtual visits. You've got your messaging, you have your capabilities to bring in those patients with specialty providers, with respiratory therapists, with other clinicians. So it is much more in-depth. So when you look at each patient, you really need to take that patient as a whole, look at their entire care plan and their entire ecosystem. Do they have a support system in place? Do they have transportation needs? Are there financial barriers? And really start categorizing this risk for this patient individually. WellSky has a lot of great built-in tools, Care Insights, Risk Point, those things that help in this, but making sure that you're utilizing all of those tools, taking everything and pulling it together, and then building a virtual care plan surrounding what that patient's specific needs are. Again, remember that not all of your patients are going to be virtual care patients just through Synzi. Some of them may need remote patient monitoring with vital signs and things like that. Some may not have Synzi capabilities. You have to figure out how that patient is going to benefit by using virtual care. And can this patient only receive text messaging? Maybe the patient doesn't have capabilities to have a smartphone to do video calls. That doesn't mean that they get written off for Synzi. You can build a cadence of text messages that flows straight to them based on whatever specialty program you have them on. So when you talk about engaging patients based on their risk status, use all of the tools that are there for you, that are at your fingertips, and really look at that patient as a whole and their entire support system, that entire ecosystem related to that patient's health and well-being.
And I think secondly, too, I'd like to just add, that's great, Haley, that when you talk about how simple this is to use, once you set up your cadences, and we have cadences set up by diseases as well as high risk, moderate risk, and low risk, and we use our risk assessments to go along with our care insights within WellSky. But that's just a push, so automatically right from the start of care, when we're looking at that patient, we're going, okay, this patient has CHF and COPD, and they're at our highest risk. We can just hit with a click of a button, okay, we're going to put them into our CHF cadence, we're going to put them into our COPD cadence, and we're going to put them in our high-risk cadence. And then that automatically pushes out those pre-planned educational pieces that go along with the protocols that we've developed inside our Progress to Goals. So very, very simple. It can actually even be done by intake. We set up our welcome calls, our welcome messaging straight out of intake as soon as we have a centralized intake system. But I just want to emphasize how easy this is once you get your cadences all set.
Thank you for adding that context, Linda. So we're actually rounding out the end of Linda, Haley, and Chris's section, and we have a summary of takeaways here on the screen now, but I think the audience would appreciate hearing from you three once more. So I'll pose the question for you. What are the top 1 or 2 pieces of advice or learnings that you would want to share with anyone that is implementing virtual care with Synzi? Let's start with Linda.
First of all, whether you're an owner or an administrator or one of those folks that are really kind of the key decision makers in implementing something of this value, is home health for most part, don't think about project management. Much like any implementation, and you're trying to shift the culture a little bit from an innovative perspective, it's really important that you put the right project management tools and person in place. I was very fortunate to have Haley, and I made sure that I freed up her time so that this could be a big piece of her job duties, and we tied it into our complex care program. So she has some other job duties along with this. But it is, you got to make sure you put the right people, you have the right champions in place. You've got to follow through with pig-headed stubbornness to get through some of our more mature folks that don't like change. It's important that you have a culture that understands kind of the infinite mindset, as you might want to say, and we, change forces us to re-innovate ourselves. So you've got to have that culture that gets the team wondering, how can I contribute in a new way, and how can we do things differently? Because, I don't want to fixate on what other companies are doing. It allows us to focus on a bigger vision of how we want to leave the world in a better place than how we started. And that culture and that thought process really needs to underline, and everyone needs to understand why you're trying to champion this technology decision and why you want to implement it and the results that you're trying to accomplish.
That's great. Chris, what would you like to add for your top advice or learnings?
Synzi will work as well as you want it to. There are so many functional things about Synzi, and what you put into it and what you desire it to look like, it can do it for you. The hardest part is getting the buy-in from all the staff, like Linda said, getting everybody to get rid of some of their old ideas about how home health and hospice was previously delivered. And to realize that this is not a one and done. You just can't walk out and say, guys, today we're going to do virtual care for everybody, and it's just not that easy. You really have to integrate it into the workflow of your organization to be successful.
Great. And lastly, Haley, would you like to add anything else with advice?
Sure, just really quickly, please remember that as you're implementing anything, you know, this being Synzi, and this is great, you know, I'm a huge proponent. Please be patient. From a leadership side, be patient with your team members, be patient with your patients who are learning this technology. Make sure you're being consistent and being clear with the expectations of the company and how to build that into that care plan. Make sure that all of your expectations are very, very clearly laid out. And then last, just share your successes. Again, you cannot share enough success stories, particularly when you're trying to sell this to clinicians. You are going to win them over not by talking about ROI, not by talking about, you know, cost saving during PDGM. When you're talking to clinicians, you're going to win them over by helping them understand that this is providing quality outcomes for your patients, and that we're able to reduce readmissions by using virtual care.
Linda, Chris, and Haley, thank you so much for sharing all of that insight with us today. And really, I want to say congratulations to all of you for everything you've achieved with such tremendous success with implementing virtual care, you know, not only for your patients, but for your staff as well. So congratulations and a huge thank you for participating in the webinar today. And for our audience, I just wanted to mention we have received quite a few questions around some of the billing and regulation aspects of virtual visits and telehealth. And I wanted to remind you all that WellSky does have a free resource center that can be found at wellsky.com/COVID-19. And we recently produced a webinar on telehealth with some legal, compliance, and operational experts. And there were a ton of questions answered on that webinar. It's available for on-demand viewing at that resource center. And that link is actually provided in the resources window on your screen right now, the WellSky COVID-19 Resource Center. So I really encourage you to check that out. There's also some written resources, including our weekly WellSky COVID-19 briefing authored by Sharon Harder that answers a ton of questions around telehealth as well. And then with the solutions questions, we'll follow up with written responses in online health in the coming days. But next, I would like to introduce WellSky's Vice President of Solutions Management, Michelle Justice. Michelle leads the solution development strategy for WellSky, and I know she is very excited to share a bit about the future of WellSky and Synzi. So take it away, Michelle.
Thank you, Shannon. I'm really happy to be here and really excited to showcase a brief overview of how Synzi and WellSky are partnering together to deliver an integrated solution for virtual visits. With all the changes that have really happened in our industry over the last few months with COVID and the CARES Act, I really think that we are at the beginning of a long-term shift towards telehealth and virtual care. You can hear firsthand from the stories that Linda, Haley, and Chris shared today, and thank you so much, team. Just the sheer number of huge successes they're having in their agencies, leveraging virtual visits and really adding more communication touch points. I really do think this is the shift that we're going to see in the future with our industry, and we're really hopeful that the industry regulations will change with that kind of rolling tide with the shift of all these new technologies that are now available in the workplace. But we're really excited to change our roadmap a little bit and shift some resources to help with this effort. And we really look forward to working with Synzi today and in the future to align our solutions to help you all optimize virtual visits to increase efficiencies and drive improved care delivery. I first want to walk through a little bit of our high-level integration and some of the touch points that our development teams are building today. Our first goal is to really synchronize the patient records amongst our two systems. And this helps reduce the double documentation that staff may do to enter in patients and really keep that information updated so that you're ensuring that you're calling the right phone number and texting that correct number for those communications. The second area that we're working towards is pulling in the patient programs and assessments that Mark presented earlier on in the presentation. That will be a PDF document that we will first attach to the patient record within WellSky Home Health and Hospice, just to track the documentation in the Synzi platform and help with that continuity of care. All of this work is really being worked on in the coming weeks and months, and I'll shift to talk through a timeline in one slide, but I wanted to talk a little bit about the future state. Like I said earlier, I really think that this is the future of where our industry is heading, and we're in this with Synzi for the long haul. Our hope is to be able to launch Synzi within WellSky directly to decrease the number of clicks and items that your clinicians do within our two systems. But it's really all about tying the Synzi virtual visits to what's actually being scheduled on the home health and hospice clinician schedules. So tying those virtual visits that are scheduled through those patient frequencies to what's actually being completed through the Synzi platform. Shifting over to our timeline, we're really thinking about this in 3 buckets. And this is really a sneak peek, kind of hot off the presses from our development teams that are working right now, actually, for this work. The patient demographics, we're really excited to have that synchronization in the August timeframe, with the PDF assessments being pulled into WellSky Home Health and Hospice towards the end of the year in December. The future state that I talked about, we don't have a great timeline on, but will be our focus for calendar 2021 going into next year. With that, I'd like to say a huge thank you for sharing your time with me today. It's truly an honor to support home health and hospice agencies like yourselves, and I wish you all the best to continue to deliver care to your patients during this critical time. Thank you.
Thank you, Michelle. To our audience, if you have questions about Synzi, please feel free to submit them in the chat window. We'll do our best to follow up with you after the webinar, and we'll provide written responses to the most frequently asked questions in a WellSky online help article, as I mentioned earlier. So in closing, when this webinar ends, a survey will appear on your screen. The survey will give you the opportunity to request more information about WellSky solutions and partnerships, including software, services, education, and more. And the survey will also allow WellSky clients to request a free trial of Synzi if you haven't already. You can also visit wellsky.com/Synzi to learn more about the solution and request more information anytime. All of us at WellSky understand this is a very deeply challenging time for healthcare workers everywhere. And I hope you found today's session to be helpful and valuable. We're here for you. Thank you for joining us, and take care.